Okay.
Ready to go?
Yes.
Okay. Thank you everyone for joining us today to our final Lunch and Learn for Research Week at Ontario Shores. It's my pleasure today to introduce Dr. Mary Chiu. Dr. Chiu has a PhD from the Institute of Medical Science and has worked in healthcare for nearly a decade, maybe a decade now, eh, Mary? In primarily geriatric psychiatry. I'd also like to welcome Dr. Sayani Paul. Dr. Paul is our scientific writer, and she has a PhD from the School of Social Work at Tata Institute of Social Sciences in India. Today, I'd like to turn the mic over rather, as we're to Dr. Chiu and Dr. Paul. They'll be talking today about cultivating a healthy environment for research and innovation. Dr. Chiu, Dr. Paul, take it away.
Great, thank you. Can everybody hear me okay? Okay, nobody is complaining. So, thank you, Tim, for that introduction, and welcome everyone. This is the last Lunch and Learn that we have been running the Lunch and Learn presentations for the whole research week, and this is our last one. And we have a special guest with us today at this presentation as well, and that's Grace Williamson, one of our rec therapists, and currently working on the with general forensics. The topic of our presentation today is cultivating a healthy environment for research and innovation. And that's something that we have a vision for, so we just wanted to kind of communicate that vision with our everyone at the organization. Just letting you know that there will be some activities that will require your phone. So like if you if you would have it handy, that would be great. Also letting you know that Sayani and I are actually presenting in the same room, but we are socially distanced. So just letting you know. So this is a little bit of an agenda, just so you know what's going to happen in the next hour or so. We are going to take up the trivia questions that we have been running for the whole week. Today's trivia questions, we'll go through them. And then I'm going to have, like a brief kind of presentation on the literature on research culture. So like, what does the, literature tell us about how that can be cultivated? And what are the elements that's important for having a good kind of research culture? And what does that actually mean for our organization at Ontario Shores and beyond? Then we'll have a little bit of a poll, with our audience. So this is where you will have to the phone. Then we are going to talk a little bit about the IT ticketing system. We'll show you, Sayani is going to show us how to put in a research consult ticket through the IT ticketing system. And that will be followed by, us telling you about our role. So Sayani will tell us, what she does in her role as a scientific writer. And then I'll tell you what I do with the research coordination and knowledge mobilization specialist role that I have here at Ontario Shores. The main feature really is we wanted to connect with Grace and have a chat with her on one of the research projects that she's actually leading as a PI, and how that interaction with research has been with her for her. And then we have an exciting sneak peek into a call for proposal, and then we'll wrap everything up with your questions and comments.
Okay, so first on the agenda, the trivia questions. So if you haven't had a chance to participate in our daily trivia questions, so throughout the week, we have been having trivia questions. Today is your last chance to submit the correct answers. So what we will be taking up the right answers right now through Kahoot. So what I would request you all to do is that either take your phone and go to kahoot.it, or you can also use your laptop, go to a separate screen on your computer or laptop, and we will find out the correct answers. Go to kahoot.it.
So I'm just going to share it right here. The game pin that you have to put in is 485115. So I'm waiting for, people to show up as participants. Holly,
Holly, we have first participant.
Trey and Laura. Anyone else coming? Katie, welcome.
Tim.
Okay. I'm going to count down. 10, 9,
Kimberly.
8, 7, 6, 5, 4, 3,
2,
2, and
1. We go.
Awesome. Erica, Kushi, are you coming?
Well, I thought I know the answer, so it wouldn't be a
Oh,
good idea.
okay. There we go. Now we're going to start. Okay. So it just runs on itself. The first question was a true and false, which is quite easy. All staff can access the research support by submitting a research consult ticket through IIT ticketing system on Shoreline. Is that true or false? I think we have almost everyone. Yes. Good job. Oh my gosh, look at that. I think everybody got it. Next question. Who is Ontario Shores Research Ethics Board Chair?
I know who it is. I spelled her name wrong. Damn it.
See?
I spelled it wrong too.
Oh no. Okay, all right. Now you know what's her the spelling of Natasha's name is. Okay, remember that. All right. So the last question that we have is also a true and false. Ontario Shores Library subscribes to Psychiatry Online. Kimberly would know this.
Yes.
Oh, look at that. And everybody, almost everybody got that one as well. Very good. So this is the podium. Third place, we have Laura. And then second place, we have Tim. And then, ta-da! The first place is
Kimberly.
Way to go, Kim.
Way to go. Awesome.
Why, thank you.
By doing this, you are not actually participating in the
It's completely meaningless, you mean?
yes, it is. You have to, and Sayani will tell you what you have to do.
Yes. So now you know the right answers. All you have to do is to type them in and send them to research@ontarioshores.ca, and then you can get your name entered for a lucky draw, and you might win a Tim Hortons gift card. So that could be all yours if you just send us your responses to research@ontarioshores.ca. And now I will let Mary talk about the meat of the presentation.
Great. So the next few slides are going to be mine, and they can be a little heavy, but it's just also very necessary and set the background for our presentation. So it's just a little bit of a look into the literature in terms of what's been done and what other people have identified as the key element to supporting a healthy research culture. And so I'm going to start with this report here. The Hanover Research is a consulting kind of company, and they have run a report on, just kind of laying out, what are the important aspects that we need to pay attention to when we're building, like a research culture. And this is specific to academic institutions. So first off, we would need to have, leadership buy-in and making sure that those goals are being communicated, and trickle downstream. And we need training and support for the researchers and for the learners. Making sure that there's enough of a mentorship, programs, and there is enough resources and funding to support their research activities. Researchers' excellence needs to be recognized as well. So that's also a very important element. And making sure that there is a healthy network for the researchers to kind of, find the right people to collaborate on different research initiatives. Some of the challenges that are kind of identified in this report when it comes to, building a healthy research environment is that, sometimes it's hard to measure, like what when we are looking at a paradigm shift or building a culture change, that what kind of indicators and measurements should we use, and what sort of methodology. The next challenge obviously is resources, because when we talk about some of these multi-million projects, yes, it's sometimes it's great to have that for 5 years, and then what happens? How do you sustain the resource, and also keeping the manpower as well? It's not only the money, and the last challenge that people may run into when they're looking into building a research culture is to continually empower and motivate researchers and learners, and keeping them, giving them the opportunity to, have professional development, self-development, and engaging them in education. So what does that actually look like when we, transfer that into more of a hospital environment and working with allied health, professionals. So, interestingly, a lot of the similar themes that we found that is important for, an academic institution to have, a vibrant research culture is also important in, in a healthcare setting. So this qualitative research here, actually, this is not the qualitative research. This one is a rapid review of 17 different studies that look at, building a research, vibrant research environment in hospital settings and healthcare settings. And so it was found that, having a governance structure, a good organization structure is very important. These 4 themes here, the second one is, a map, exactly onto, the first theme from that other report from the Hanover research. Leadership and management buy-in are super important. Once we have the buy-in, then everything downstream would be so much more supported and aligned and integrated. We need the tools, resources, and time, and the systems to support all the research activities. And this here is the theme 4. Is unique to this rapid review here. Is that, well, how do we make sure that we engage and continually empower the clinicians to kind of, convert some of their clinical or empirical evidence that they have into a research question, and then eventually a research project. And then this is sort of something that is very dear to my heart currently, is to look at the impact, right? So evaluating how research investment and some of the research impact on a kind of like a hospital like organizational level. And this study here from Australia actually look at interviewing us. They interviewed 6 executives and senior management team and asked them, you know, what are some of the contextual influences that would influence the main factors that is important when we look at research culture. So and it's all there. Like you have to start with, you know, having secure, you know, the human resource and also the financial resource, and then that is going to fit into you know, like a kind of the research capacity and the vibrant kind of like activity of research. Then we doing with the outcomes and the findings of the research that we are having. We're using that to influence change in the clinical practice, and our kind of, you know, final thing that we're evaluating obviously is that how is all of that impacting the quality of care that we're providing to our patients.
So just to tie up what Mary said and what in our context, in the context of Ontario Shores and specifically for research and academics department, is how we are striving to ensure that we build a healthy culture of research. Is one is by really engaging with staff both across the center in conducting research evaluation projects and quality improvement projects, really encouraging to turn your research observations into a clinical observation into research questions. And in order to do that, we are also informing evidence-based and best practices through literature search and synthesis, and we have an excellent literature library service here. In this process of literature, we are also ensuring that we develop the right collaboration with the right stakeholders across the research life cycle. And this collaboration can mean not only just within the center, but also externally collaborating with academic institutions, with research institutions. Also, this collaboration might look like a researcher-clinician collaboration to ensure that not only just to ensure that the clinician have the right tools and research experience in the conduct of research. And more importantly, we are striving to translate the wonderful research findings into clinical practice, which will ultimately benefit the end service users. And it can be in form of clinical practice guidelines or toolkits or resource guidelines, whatever. And in all this process, our ultimate goal is to ensure that we are also constantly building capacities of our staff and researchers in the conduct of research, as well as we are measuring the impact.
Great. So, and just to catch the, you know, like a tail end of what Sayani was saying, one of the elements that we are trying to, you know, kind of build is capacity. We are going to do a little bit of a poll here, and if everybody can go to www.menti.com, and we are going to see where you fit into in these 3 scenarios here. So I'm going to actually share screen, and so everybody can actually see what's as the results come in. Only 2 people wanted to tell us what scenario you fit into. Oh, okay. That's wonderful. Okay. So as the results are coming in, like it's all great here. And it illustrates a point when we are talking about capacity building. So our job here at our research is we're providing a lot of support right now, and we're going to talk a little bit more about what kind of support we provide later on in our presentation. But like our ultimate goal is to empower like all the everyone who may or may not have the experience of conducting a research, but is like passionate about it nonetheless. And we want to like give you the necessary tools and also the kind of knowledge to so eventually you can lead your own research initiative or projects. So that is our kind of one of our main objectives and here at research.
Okay. Okay, I will just quickly.
How's everyone doing so far? Is this too heavy? Some thumbs up or something. Okay, I can move it.
Okay. I will quickly walk you through the IT ticketing system for research consults. So on our first Lunch and Learn presentations, our director, Tim Pauly, mentioned about the IT ticketing system and how we are urging everyone to kind of go through this route to submit your research consults. So today, in the next couple of minutes, I'll just walk you through through the system, just to kind of let you know what is it and how is it. So this is a very familiar page on Shoreline when you click on the IT service request. And there is an option of research and academics request. And under that, there is actually a bunch of options that you can go for, which we think that kind of captures all the milestones that one would encounter in a research life cycle. And for each tab, for each option, we have a detailed instruction. So even if you are not sure as to what is it, you can go to the instruction to read it actually, but what is it, what does it mean? So for example, if you have a research, oh, excellent, sorry. Sorry about that. So if you have a research question in mind and would like to develop a research protocol, or maybe in planning to do an evaluation and want to develop an evaluation protocol, this is the option you would be clicking for, and with some little details about what you are trying to do. This is a mandatory question so that we know that what kind of support is required, whether it's a quality improvement initiative or a research protocol or a clinical trial. Some of these findings, some of these options might not be always applicable, but and you can click not applicable. It is not, if it is not applicable to your research, and provide few keywords of or area of research for your project, and then just save. So it is that simple. I will walk you through my own portfolio of scientific writing. So when you click on scientific writing, it will again prompt you to another tab where you can either click on presentation or writing. So within presentation, you have 3 options. So basically, if you need any kind of support in terms of your in terms of developing the content or refining or formatting of your slide deck presentations for a conference presentation or a community presentation, or even internally any meetings, or for poster consultations. So you can click on this and kind of follow the same thing and submit. Within writing, This is where I get most of my consults. Writing, there are 3 options. Report development, which kind of comes in. So it can be any kind of project. Again, if you are thinking of writing the report, maybe you need to submit a final report to your funder. So we can support in developing the content of the report, or even if you have written the report and need a fresh set of eyes to look into it, we can review it and provide that. Peer-reviewed journal manuscript, again, anyone, whoever is needing support, wants support in developing, reviewing, or submitting a peer-reviewed journal manuscript, we can help with that. We can support that process, and it can be actually anything. It can be a quality improvement paper. It can be a research manuscript. It can be a thought leadership paper. So whatever. So yeah, and we would really encourage you all to use this system to kind of to put in your request so that it's more streamlined and more time efficient for us to kind of manage. Okay. Briefly about myself and what I do. I'm relatively new at Ontario Shores. I joined in Ontario Shores in last year, in June 2020, right during the pandemic. I'm a registered social worker, and my background has always been in mental health. Some of my interest areas are working with youth with mental health conditions and their families, specifically transition-aged youth, and when they are transitioning from the child and adolescent mental health services to adult mental health services. And there's a ton of research that informs that that's the time when they fall through the cracks. And I'm very interested to see how access issue works at that point of time. Mental illness, stigma, and discrimination is one of my area. My doctoral thesis focused on that. And I've worked with some of the very vulnerable populations, including individuals who are experiencing homelessness and living with mental health or addiction issues. In my role as a scientific writer, I really work with clinicians and researchers across the center, again, to support manuscript writing and submission. That is one of my key role in grant preparation and submission, REB application preparation and submission, to really, and in this process, I also engage in a lot of literature, lit reviews and synthesis, data analysis, to really see how the study findings are informing the existing, are contributing to the existing literature, how best to kind of craft out or develop a compelling story, and how best to reach the findings, to tailor the findings to the right audience so that the findings are meaningfully disseminated. And in this role, I also work very closely with Mary to kind of to ensure that research findings, the knowledge mobilization happens in a very integrated manner. And at the end, as Mary said, that in all this, one of my objectives always that is also to build capacity of the staff whoever I'm working with in manuscript writing, in grant writing, and things like that. Next is Mary.
Yeah, thank you. So, I joined Ontario Shores last year as well, just a few months before Sayani joined. My background is, and my passion really is in geriatric psychiatry. And my research focused on dementia care and looking at the psychosocial well-being of dementia caregivers. And like what is the interface between the working and caregiving. And I have also done a lot of program evaluation or effectiveness evaluation for psychotherapy intervention for family caregivers. This year is like one of my most recent publications. It came out in Aging and Mental Health in January this year. And really it's like, it's looking at the, what are some of the elements or factors that contribute to caregiver burden for people who have to juggle work between work and caregiving. So now my role at Ontario Shores is really to kind of implement some of those elements of success when we are talking about mobilizing research and creating a research a culture or environment that's conducive to development and improvement. So my vision is always about putting the patient and family first, and that's kind of aligned with the organization's view as well. The quality of care for patients is of utmost importance. They are one of our biggest stakeholders, and so how do we kind of navigate and be able to mobilize the complex infrastructure here at Ontario Shores to support the research initiatives, which would then generate all these findings and outcomes that would then inform the care and clinical guidelines and etc. So we already talked about the different elements of what I do as a research coordinator and knowledge mobilization specialist. In my last few months as the interim manager, that really gave me kind of a first kind of view of how complex the Ontario Shores system is. And there are so many players that actually would need to be engaged to help support a healthy research environment. Everyone from risk, quality, finance, decision support, clinical informatics, IT, library services, professional practice. All of these different units have to work very closely with the external and internal researchers that we're trying to support. And all of these stakeholders are going to kind of work together to build a good kind of evidence-based practice that will support our patient and family population. And that is going to lead us to the next part of our presentation, which is the main feature of this of today's luncheon. And we will have, in the next 15 minutes or so, like a very candid chat with Grace. Just, as we were saying, Grace has been working with the research department to kind of support. We support one of the projects that she's leading, and so just to begin, I guess can you just tell us about yourself and the role here? I know it's all on the slides, but probably better you.
Yeah, no problem. Well, thank you for having me. I'm super excited to sort of chat about my experience because I personally think it's been a great one. But my name is Grace, and I am a recreation therapist for the General Forensic Program. My role involves primarily providing meaningful and therapeutic interventions for our clients that really promote personal recovery and well-being. So we try to provide programming that supports all domains of well-being, including social, physical, emotional, spiritual, and cognitive well-being for all of our clients. Through my role as a recreation therapist, I also got to become a peace love creator, which is sort of the juice of what we're going to be talking about today. And And the Peace Love program is an organization that evolved out of the States. It was actually developed by a gentleman with lived experience who found his own peace of mind and improved well-being through art. And so he wanted to share his experience, and that was sort of what spiraled into the Peace Love program. And through that program, they provide training and education for frontline professionals to facilitate expressive art interventions. And so those are what we'll be talking about today.
Wonderful. So my question is that what prompted you to undertake this research study? Like, you are leading the study. What prompted you to undertake the study?
A couple different things. One is the profession of therapeutic recreation has really been making an effort to demonstrate and showcase the effectiveness of the programming we offer to our clients. So we have a lot of qualitative feedback, informal evaluations, word of mouth, and reputation as rec therapists that we provide really meaningful, important programming for the clients, but we don't really have the numbers or the data to really inform clinical practice moving forward. I was really inspired after becoming a Peace Love creator, hearing about the impact this program had on clients and staff. So we provided the workshops to both inpatients, outpatients, and frontline working professionals. And the original evaluation feedback that we got was really powerful and really inspiring. And so I was passionate to take that on and really see sort of where this could go. How does it impact recovery? And how can we utilize this information to inform practice moving forward? So a couple different.
Great. So can you tell us a little bit about your study? You know, like what is your objective? You know, like what was the setting? You know, who do you like? What are the who are the individuals that are involved in this study? That sort of thing.
Sure. Yeah. So our study objectives were to see if the program impacted personal recovery, and to try and understand what elements of expressive arts specifically impacted in the context of personal recovery, like what impact did it have, if any. And so when we developed our protocol originally, our goal was to look at inpatients and outpatients participating in the Peace Love workshop program, which is 6 weeks. There's 6 specific interventions. And those workshops were offered in the Recovery College and the Forensic Treatment Mall. So we tried to be as open as possible, self-referred to the program. It's a mixed method, so we wanted to look at try and get some quantitative data as well as qualitative. So we used the recovery assessment scale and focus groups. And ultimately, the focus groups is where the real juice of the content came from, which kind of aligns with the recovery philosophy in general, and really provided us with some remarkable feedback that I am excited to share a few snippets with you too when we get there.
Okay. Now, we know we all are here, and if you have to criticize us, you can feel free to do so, but really interested to know about your experience of working with the research staff. Like we talked about researcher clinician collaborations. So I would like to know as to how did that work for you? What was your experience of working with us, with the department?
Yeah, I think it was really fantastic. I mean, this has been an ongoing process for a couple of years now. And I think that in itself speaks to the support that I received and the flexibility of the program. Our first protocol was actually drafted in 2019. But between my maternity leave and the COVID pandemic restrictions, we've really sort of had a lot of bumps in the road in terms of getting this drafted. But throughout the beginning, it was really, I felt really supported. I'm a frontline clinician and I just had an idea and I didn't know what to do outside of that. So it really, the entire process has been made me feel supported and that I had the resources available to complete this project. Because honestly, outside of what I had to complete to do my degree, I have no experience in research. So it's been a really great learning experience for me. And ultimately, like I do feel now that I've done it with the support of the team, I have the capacity to hopefully do more in the future.
Awesome.
Yeah, it's been great.
Are you, well, like you're working with Sayani and I right now, and Julie Murray is also involved. And we have, I understand we have analyzed the data together. We have been coding our data and, you know, with some themes for, and you mentioned earlier, you know, like you have some of the quotes that you would like to share with us. Do you wanna take it away?
Sure. Yeah. I'm also super excited and relieved because we're in our final stages of manuscript writing and finding our journals to publish in, and it's really wrapping up, and it has a real sense of satisfaction with it. Like after such a long, bumpy process, it's finally coming together. And yeah, it's really satisfying too, because we have such amazing content coming out of the study. We, with our transcript coding and analysis, we have 4 themes that really did emerge. One of them being that art is a medium for self-expression. So art in itself is a way for patients to express themselves. The programs also provided an opportunity for self-exploration and self-discovery. That the program supported recovery, and that's utilizing Mike Slade's CHIME framework. So we saw themes of connection, identity, empowerment, connectedness with others, all emerging in the data. And we also saw a general theme for improved well-being. A couple of the specific quotes that I think are really powerful, which I'm allowed to share. One being that it was just a way of expressing myself without having to write about it. It was just a free way to express myself, and there was a freeness to that. It was an opportunity to show how I feel and what emotions I'm experiencing that are going on inside of me without having to write about it or use words. The program was a great self-discovery tool. It expanded my awareness about who I am and the aspects of either what I've been going through or how it makes me feel. It was showing me that I can be resilient and that anybody can be creative in their own way if given a chance. And this program helped me learn to be myself again. I shut myself out from people for a really long time, and I didn't know why that was. So this helped me get in touch with myself again. And finally, another good one is, even though I'm not feeling well in the moment, I still knew that if I came to this workshop, I was going to feel a whole lot better when I left. Really powerful.
Yeah,
I do.
that's just beautiful. Thank you for sharing, Grace.
Yeah.
You know, like the collaboration, like I think I can speak on behalf of Sayani as well. You know, like, both of our experience working with you it's been so wonderful. It's the willingness of you know, like of you wanting to collaborate with, and then like us, you know, like trying to figure out how to support you. And this is one of the you know, best examples of, you know, like a clinician working with researchers and trying to, you know, bring you know, like a clinical observation into a research kind of research lens and kind of showcase, like what are the impact of a recovery, a peace love program have on our patients, and including the voice clients as well, right? Like it's and there is like a whole line involved as well, because like obviously all these narratives is going to inform the next iteration of programming as well.
Yeah,
So,
absolutely.
yeah. So thank you so much.
Thank
for,
you.
like speaking with us, working with us, and like we're almost in terms of getting the manuscript out, and it would be such a wonderful documentation of like your work and your both in the clinical world and also in the research world.
Yes, it will be
Awesome.
definitely good contribution to the literature.
Yeah.
We hope so. Well, thank you so much for all your help. I really do appreciate it.
Thank you so much, Grace, for sharing. And this actually very well flows with the next agenda. The call for proposal.
Okay, so this here is kind of like a brainchild of our director. And like what's better to like to kind of build a research culture than putting out a call for proposal. Yes. And let's see like what our staff and clinicians everyone at Ontario Shores may kind of want to bring to the research table, I guess, for kind of like for us to work with you to see what kind of exciting discovery we're going to make together. So what is a call for proposal? It is an opportunity to work with our research team to turn the questions that are relevant to your area of practice into a research project. Who is it, who is eligible? Open to all staff at Ontario Shores. So sorry, Laura. And, it's unfortunately, this one is just for us here. When is it going to happen? The launch for proposal, the launch for the call for proposal is going to be June the 1st, 2021, and the application form will be made available to all staff either through like a mail listserv or through the ticketing system. So how are you going to submit your proposal? Is going to be through the IT ticketing system that Sayani was showing us earlier. And this is just a sneak peek. This is special thank you to Robin Bate because she built all of these for us, especially for this presentation here. But this is still in the test environment currently. But essentially what you can do is, like what Sayani was showing us earlier, is that you can, go to the Dropbox that's here and then click on a special research week call for proposal, select that, and then you will, like a special instruction would be available there. And this here is also where you can access the application form. We'll have a link to the application form, and you can download it straight from there. You can put in your request details, tell us who you are, what are some of the key focus that you would like to let us know about this call for proposal application. And then you just, click submit. You can do it as an individual or you can do it as a team. So if your unit or, your clinical team or has, something that you want to put forth, you are welcome to submit it through the IT ticketing system. One caveat is that we are not accepting application through email.
Yeah.
So this is only going to be accepted on the IT ticketing system. So any questions, you can actually let Sayani and I know. And that actually wraps up our, oh my goodness, we did well with
Yes,
time. Wrapped up
yes.
our presentation, lunch and learn. Just wondering if you would have any questions.
Just to continue what Mary said, the call for proposal will be running from month of June. So it is from June 1st, the last date is June 30th.
Thank you, Tracy. Wondering if there would be any comments, questions. Oh, okay.
Hey, Grace, I just want to say thank you and acknowledge you for your contribution. It really means a lot to me that you acknowledged how the support from the research team has really kind of helped you develop as a rec therapist / scientist. I'm really, really pleased to hear that, because that's exactly what we want to achieve by supporting frontline staff across the center. And the other thing comment I'll make, Grace, is even just listening to you talk, like, it's clear that you're picking up the research lingo, and that's such an incredibly important part of developing as a clinician scientist, because oftentimes if the researchers and the clinicians aren't using the same language, there can be a lot of like phone tag and what's that broken phone. If you're not using the same language, because then it makes it really difficult to talk about design and analytics and application and knowledge translation. So I'm really, really pleased that just even listening to you talk, like, I can tell that you've developed as a researcher. So thank you.
Thank you.
Yeah.
Thank you.
Grace is definitely one of our superstar.
One of your stars, yeah.
Yes,
Yes, that's true.
been a pleasure.
Working, yeah.
We might have to do a profile piece on you, Grace, when we have your study finished.
I'll be off on mat leave again. So I'll direct that somewhere else.
Okay.
But no, it really has been a pleasure. Like, it's been a great experience from the start, I said. Not only was it supportive, but it also built the capacity within myself, I feel, moving forwards, take on future endeavors. So I look forward to that when I return.
Awesome.
We'll see where it goes.
Wonderful.
Any other?
So just letting everybody know that the presentation is going to be available on Shoreline, and I will be also be able to send out the slide deck as well, if that's of interest to our audience.
Yeah, actually, all the presentations will be uploaded on Shoreline, so whoever wants to check them out. Yeah.
So okay, thank you, Kushi.
Thank you.
So if there's no more comments, questions, thank you everyone again for coming. You have 3 minutes to go and have a nice walk outside.
Yes. And with this, we conclude the research week.
Yeah, I know. And it's been a pleasure.
Yes.
Thank you, Sayani. Thank you, Mary. This is a really great presentation. I think this is my favorite from the week.
Thank you. Thank you.
Thanks.
Thank you.
Okay. All right. Have a great weekend, everyone.
Have a great long weekend.
Yeah.